Welcome back to Bay Area Focus. From cancer screenings to hygiene kits, the Women's Community Clinic offers a range of services to San Francisco residents. Carlina Hansen and Kemi Rollet will tell us all about them. Hello, ladies.
Hi.
How are you?
Good, thank you.
Thank you so much for joining us. We spoke about a couple of other services that you offer. Tell us more.
Well, the Women's Community Clinic was founded in 1999, and we exist to provide access to health care, outreach, and education, and we also do a lot of workforce development. And really our mission is to improve the health and well-being of women and girls.
Okay. And so age of patients you see, does it matter?
It doesn't matter. Most of the people that we see are in their 20s, 30s, and 40s, and we predominantly provide care for sexual and reproductive health services, as well as full scope primary care.
Okay. Any outreach that you do, or do you see a lot of patients just kind of coming in, you know, walking in because they've seen you or they've heard about you?
Absolutely. So a lot of our clients hear about us through word of mouth, but we also have a really big web presence. And we also do have a lot of outreach programs, so we're doing a lot of community-based outreach and education with a special focus on the Western Addition and Mission neighborhoods.
Okay, and I hear that you have a program called the WAT program. Mm-hmm. Tell us about that.
So the Western Addition Health Training Program was a program that we founded at the clinic in 2007, and it was really a geographic specific response, recognizing that there were a lot of unmet need in the Western Addition, but also this really rich history of community activism, and also realizing that there were a lot of single parent households, particularly led by women. And so the Western Addition Health Training Program both combines access to sexual and reproductive health education and workforce development as well.
Okay, and what do women come to you most for, would you say?
I would say our biggest services are our sexual and reproductive health services. That's what we have been doing since we opened our doors. And as we've seen in the news lately, there are still a lot of attacks on women, unfortunately, and particularly with regards to women's health. So it's extremely important that women have access to health care that is safe, affordable, and respectful. And we really like to send the message that regardless of people's ability to pay, they deserve the best care that they can get.
Okay, and with that, the Affordable Care Act, how has that impacted the Women's Community Clinic?
It's had a really huge impact on the women that we see, and that people have been able to access care that never were able to access it before. So we're seeing people come in our doors that are so excited to be able to have coverage. At the same time, San Francisco is, as we know, a very expensive city, at about 60% higher than other major metropolitan areas for the cost of living. So there's still a lot of people falling through the cracks. So places like the Women's Community Clinic are really critical in being able to provide access to care for women who may not otherwise be able to afford it.
Okay, so we can't bring a camera inside the clinic, but we have some pictures to show.
Great.
Let's talk about that, and we'll give some viewers a picture of what it looks like inside your clinic.
Yeah.
So we have two of our health workers. The clinic has a very rich and robust health workforce development program who here are doing some lab processing of clients that we just recently saw. And we also do a lot of community-based health education, and so these are workshop participants who build a model of a uterus, and so we use a lot of different interactive methods to teach women around their reproductive anatomy, sexually transmitted infections, those types of things.
Okay, and I think we have one last picture here, I believe.
And this is actually one of our WAT participants, and she is a clinic supervisor, so she helps to both manage the clinic floor, interact with our clients, connect with our clinicians, and so by the time she graduates from this program, she'll have a really robust set of skills.
Okay, and so you said that you're seeing a lot more women now since the Affordable Care Act. How do you guys run? A lot of volunteers who help you out?
Yeah, absolutely. We have a lot of workforce trainees and volunteers, about 100 health workforce trainees per year. and they help us deliver responsive services to the community, and at the same time they get workforce development training in health careers. About 80% of them then go on to pursue careers in the health professions, and we really love that because they are bringing our message back to the community, and they carry forward their commitment to accessible community health.
All right, anything else you guys would want to add for women out there listening?
Absolutely. If you are a woman out there who is looking for healthcare, please come to us. You can find us on Yelp, and we have extremely great ratings. And also, if you're interested in our health workforce training programs, you can check us out at www.womenscommunityclinic.org.
Isn't Yelp a great thing? You read those reviews, and as soon as somebody has a good review, you're like, okay, I think I'll check that out.
Yeah, it really tells a story.
All right, thank you so much. Thanks, Carlina and Kemi. For more information on services at the Women's Community Clinic, log on to womenscommunityclinic.org. That's womenscommunityclinic.org. And coming up, a nonprofit bringing diverse dance performances to the Bay Area.